Everyone experiences a range of emotions, from sadness to anxiety to joy. But due to a variety of factors, such as heredity, environmental stress, and the use of psychoactive drugs, these feelings can become distorted and impair one's life.
I think a lot of it has to do with my parents, like divorcing, like really affected me, and that kind of changed my mindset and like the chemical makeup of my brain. And
when the loss of the ability to cope is severe enough, it can be defined as a mental illness, such as major depression, bipolar disorder, schizophrenia, generalized anxiety disorder, or panic disorder.
They diagnosed me with severe post-traumatic stress disorder, severe recurrent disorder, and then DID, which is dissociative identity disorder.
I was younger, probably around 12 years old. I started having a lot of depression. Then later on, paranoid schizophrenia came about.
If psychoactive drugs are responsible for the dysfunction, it can be defined as drug abuse or addiction.
Then I started getting dope sick, and then the stealing started happening, and all the horrible things that go along with continuing to be a drug addict.
Of the 40 million Americans who have a mental health disorder, about 25% abuse drugs. This works out to 10 million Americans who have co-occurring disorders, also referred to as dual diagnosis or comorbidity.
Well, I think the depression came first because now that I'm sober, I realize that I was just masking the depression with the alcohol, and I did so for a long time.
So two questions that should be explored are, how do these two conditions interact with each other, and how can they be treated?